So good morning and welcome to our first Family Caregiver webinar. I'm Debbie Emerson. I'm Hope's community health educator, and my primary responsibility at Hope over the past 5+ years has been to develop and manage this Family Caregiver education series. Back in the day when life was normal, we held our classes on Saturday mornings and actually got to be in the same room with each other. And I do miss that. Since that's not possible now, the best we can do is present you with the same, hopefully valuable information, but in a virtual format. But again, I do hope that one of these days we're going to be able to actually physically get together again. So for those of you joining us for the very first time, just a little bit about me. I've been a health educator for over 35 years. Prior to joining the Hope Hospice team in 2014, I taught health education and advanced placement psychology in the Pleasanton School District. I retired a little bit early and very soon after found myself as my mom's caregiver for several years. She had numerous diagnoses, including vascular dementia. After her passing in 2014, I embarked on a new career path, and that was to help other family caregivers with their journey and sharing everything that I had to learn the hard way. So every class and now every webinar in the series reflects what I learned or what I wish I had known when caring for my mom. And just a little note, I'm so indebted to all of you who've been coming to my classes over the years because I actually learned so much from you. I would now like to introduce you to the newest member of our Hope Hospice caregiver education team, even though she's been with Hope for quite some time. And that's Gia Barcel. And Gia is our new manager of dementia services. As you know, Jill retired on the 1st of July and moved to Indiana to be closer to her family. And I'll miss working with Jill, and I know many of you will miss interacting with her as well. But Gia is really well qualified, and I know you're going to like working with her. She's going to be teaching the dementia classes, facilitating dementia care partner support groups, offering individual and family consultations, and providing dementia training for care facilities within our community. And Gia and I are actually going to team teach next month's webinars that both are dementia related, and those are going to be on September 10th and 16th. I'll put information about those up in just a few minutes. And I'm excited that all of you are going to have the opportunity over the next few months to get to know Gia better. So Gia, do you want to say just a couple of words?
Hi everyone, Debbie, you summed it up beautifully, so thank you. I'll just say that I'm happy to be here and I'm looking forward to working with everyone.
So did I say more than I should have, Gia? Should I?
No, you said it so perfectly and succinctly that I just get to sit back and absorb it all. It was perfect.
All right, okay. So yeah, and Gia, I'm so excited that you're going to be on the team, and I can't wait until we do our dementia classes. And
Thank you, me too, right back at you.
It's going to be fun. And so you've seen Phil on the screen, and we're really lucky to have Phil with us. And he's going to be our technical support for the webinars. And Phil's been a home care volunteer at Hope for the last 3.5 years. And prior to coming to Hope, he was a senior engineering manager for Lockheed Martin. And he's also, somewhat of a dementia specialist. He's gone through our Living with Dementia training program and has helped Jill with her dementia classes over the past couple of years. So because this Zoom business is new for all of us, I wanted to have someone available to you during the presentation, just in case you have some kind of technical difficulty. So you can text Phil on his cell phone if you have an immediate computer need. For example, if you're unable to see or hear. And so his number is up on the screen. So for those of you who attended my classes back in the day when we met in person in the Hope Hospice classroom, you know that I always had tons of handouts and resources for you. So you'll still be able to get those, but now it's going to be in an electronic format, no paper. So all of our handouts, the PowerPoint slides, I know in the past you were used to getting copies of the slides, and I still have those for you, as well as a recording of the presentation is going to be posted on Hope's website. By the way, when you see this little helpful resource icon, that's a little indicator to you that there is either a link or a document that's related to that particular item, the item that I'm talking about, if that's going to be on the resource list. Some upcoming events. We do have our family caregiver webinars scheduled through July of 2021. But right now we only have registration links on Hope Hospice's website for the webinars through December. In October, we'll add the rest of them. So our next webinar is going to be from our Living with Dementia series, and Gia and I are going to present our Dementia Basics class on September 10th. And by the way, even if you've attended a lot of our classes in the past, the webinar classes will be slightly different. You know, I'm having to completely reformat everything that I've done in the past. So as I do that, of course, I'm going to be updating it with information. So hopefully, if it's your second or third time watching it, you'll still learn something. Hope Hospice now has a town hall webinar series. And if you're on Hope's mailing list, you'll receive email announcements, or you can always check Hope's website to see what's coming up. For those of you who have loved ones with dementia, the town hall webinar on September 16th specifically focuses on how to deal with all of the new issues that face dementia care partners during the pandemic. And she and I will be team teaching this webinar, brand new class. And on October 15th, we're bringing back Julie Fiedler, an elder law specialist from Horizon Elder Law in San Ramon. And Julie has spoken at our family caregiver classes several times over the last few years. She is so good. Everybody always loves her presentations. And she has really generously agreed to try out this whole webinar format with us. So we're really going to be happy to have Julie on board. And you can register for all of these classes, again, at on Hope's website. Okay, just when we think that being a family caregiver can't get any more challenging, we're hit with a global health crisis, and everything changes. So if you're feeling overwhelmed and frightened and frustrated and anxious, you're not alone. These are very rational fears. In fact, these fears may be among the few normal things in these very abnormal times. And just another little note, there's a lot of talk these days about essential workers. I want you always to remember that family caregivers are their loved one's lifeline. So I want you all to feel really proud of the essential work that you do. And then I have two overarching goals for today. First of all, I want to share with you some really good resources that can help you in your caregiving journey. But I also would like to challenge you today to think a little bit differently about the situation that we find ourselves in these days. I'd like you to try to view the pandemic as a means to bring about some positive outcomes in your life. We can't change the situation, but we can certainly change the way that we deal with it. Crises force us to become more creative and more resourceful. And we've all heard the saying, necessity is the mother of invention. This is a time that necessitates exploring and creating ways of doing things differently. And I suspect we've been in this 5 months now. I suspect a lot of you have already started doing things differently and coming up with creative ways that work for you. Whether we like it or not, we are now tethered to technology. I personally try to look at it as a good thing because it keeps my brain active. We can't underestimate the importance of caring for one another, especially these days when our society feels so fractured and so many are feeling disenfranchised. So having compassion, empathy, really listening to one another, becoming more socially responsible, offering to help our friends and neighbors, and even those we don't know personally, standing up for what's right. The simple act of wearing a mask, for example, in public, and physical distancing can send the message to others that you care about them. A focus on overall health and well-being is more critical now than ever. Maintaining our health and keeping our immune system strong has now become a survival skill. And you all know from my classes what a self-care advocate I am. Self-care is a necessity. It has to be our priority. We have to take care of our own emotional, physical, social, spiritual health, not only for ourselves, but for our loved ones. Because as we've heard so many times, we can't care for another until we first care for ourselves. So we've got a lot of new challenges with this situation. If your loved one lives with you, caring for your loved one in your home gives new meaning to the term 24/7. You may feel trapped, as if there's no escape, which, by the way, is a pretty common feeling for everyone these days. You quite possibly have lost your support team as you try to minimize contact with others. So, of course, both you and your loved one are feeling isolated. Providing care has gone beyond managing the activities of daily life and going to medical appointments. It now includes critical aspects of life and death as you try to protect both your loved one and yourself from this unfamiliar and unpredictable enemy. Every aspect of our lives has become more complicated. And you may feel as if it's all on you. Saying that you're overwhelmed is probably an understatement. And for those of us who are caring for a loved one with dementia, we're facing even greater challenges as we try to help those with memory, language, and reasoning impairments try to understand what's going on, why their lives have changed, and how to remember and follow all of the new and ever-changing rules. It's hard for us to do that as well. By the way, if your loved one has dementia and you feel that you need support, please call the Hope Hospice office and ask to speak with Gia, our dementia specialist. As I mentioned earlier, also on September 16th, Gia and I are going to be presenting a town hall webinar that specifically deals with how to care for a loved one with dementia during this pandemic era. Hospitalizations, going to the ER, medical appointments used to be challenging, and now they're terrifying. As a result, a lot of people are putting off getting very basic medical care, which is not a good thing. I totally get that though. If you have young people in your life, as do I, you've probably heard the term FOMO, fear of missing out. I recently read an article where the author noted how now our new acronym is FOGO, fear of going out. Something I think a lot of us are experiencing right now. I know I am. When I put this presentation together last May, I included an article on the resource page about how to deal with fear and anxiety as our country begins opening up. Silly me, I actually thought things were going to be getting better, but no. So this time around, I have a couple of new articles that I've included. One is how to deal with the psychological impact of re-entering quarantine, and the other one is how to combat crisis fatigue. So since there's no one-size-fits-all solution for caregivers who reside with their loved ones, this has to be a time for creativity and finding strategies that work for your situation. And I suspect, as I mentioned earlier, that a lot of you have already started doing that. We're relying more on technology to help with everything from social connection to managing day-to-day tasks. There's a lot of helpful resources out there, and I've listed a few on your resource page. And again, we face the same problem that we've been facing for years with the internet. It's not a matter of not finding enough things. It's a matter of there's so many things, we don't know what's good. So what I've tried to do today and what I'll try to do throughout this entire webinar series is kind of check out those resources for you and give you ones that I think are legitimate and helpful. So from everything I've read recently, it looks like our lives from now on are going to be driven by technology, whether it's pandemic time or not. And I also read, I believe in an AARP article, that only 28% of people over the age 60 are comfortable with technology. So if you've been thinking about taking some online classes or updating your equipment, now is the time to do it. So instead of spending money on that trip to Italy, that's probably not going to happen, maybe spend that money on some new computer equipment that's going to have the latest bells and whistles. Medicare has relaxed some of their HIPAA guidelines, and most physicians are now able to address medical issues by phone or computer, possibly even curbside. We're beginning to see a growing trend towards concierge medicine, where the physicians can actually make house calls. So call your loved one's healthcare providers, see what accommodations they can make for you. So telemed is another thing that's probably going to stay with us even after we have this pandemic under control. And even though there are some disadvantages to it, there are advantages that we need to look at as well. And those advantages are both for us and for the healthcare professionals. If you haven't already used grocery, meal, pharmacy delivery services, again, now might be a great time to start. I never used those in the past, but I've actually been really pleasantly surprised with how easy and reliable the services are. You may have lost your direct support system due to worries about infection, but please continue to accept help from family and friends. While they may not be able to come into your home, they can still run errands, help in the yard, make phone calls, support you in whatever creative ways that they can. I recently learned of a service on the social media site Nextdoor, where people can post their offers of help, non-contact of course. So when you go to the site, it will show you a map of your immediate area, your neighborhood, with big dots to indicate the name and location of a neighbor who's offered to help and what kind of help they are able to provide. Or if you're able to help someone, you can post your information. People love to help, so let them. Don't think it's a burden on them if you ask for their help. Because when this is all settled down, you'll still have your support team in place. You can transition them back to providing more direct care for your loved one. Hiring in-home care from an agency understandably comes with its own set of concerns from both the family and the care recipient. But this may be a good option for getting the in-home care that you need. And if having help from a home care professional prevents a trip to the ER or hospitalization, or if it helps you, the caregiver, avoid burnout, then the benefits may outweigh the concerns. So just a couple of quick clarifications. Home care refers to basic care needs such as eating, grooming assistance, light housekeeping, companionship. This is personal care. It's also known as custodial care. And this type of care is not covered by insurance. And most people will have to pay out of pocket for this. There are some other options, but in general, we have to pay out of pocket. I don't want you to confuse personal care or home care with home health care. So the key word is health. Home health care is typically ordered by a physician after a hospitalization or outpatient surgery. So these are medical services that are rendered by healthcare professionals such as nurses, physical therapists, occupational therapists, etc. Home health that's prescribed by your physician is actually covered by your medical insurance. And Medicare.gov has an excellent online evaluation tool to help you in selecting a home health agency. And I actually have that website on your resource page. There are a lot of reliable home care agencies out there. Just be sure to screen them carefully. Ask your friends, your doctors, people that you trust, ask them for referrals. And that's kind of the best place to start. Always check out the home care agency's website. That website should contain information about how they're addressing COVID and following CDC and county guidelines. That information should be the first thing you see on their website. Some agencies train their staff on best practices for interacting with those living with dementia. So if your loved one has dementia, that would be an important consideration in selecting a home care agency. Ask the agency to send you a packet of information that lists their services, fees, and references. Be sure to interview potential caregivers on Zoom, FaceTime, or Skype. Also, some agencies allow a free trial period to see if the caregiver is a good fit with your family. So ask about that. The California Department of Social Services keeps an online registry on home care workers that have gone through background checks, and there is a link to that site on the resource page. And I wrote a blog article on this very topic that contains comprehensive information about every aspect you can imagine of hiring in-home care, whether it be personal care or home health care. So I encourage you to check that out if this is something that you want to explore at this point. By the way, my best advice, investigate home care before you actually need it. You have so many more options when your decisions are not driven by a crisis. If your loved one lives in a residential care facility, such as assisted living, skilled nursing, board and care, you face what may seem to be insurmountable challenges. You're prohibited from visiting, assisting with care. In some cases, maybe you're not even allowed to drop off cards or packages. We see stories in the news about how nursing homes are hotspots for the coronavirus. And of course, we worry if our loved ones are safe. Is the facility following proper infection control protocol? Is the staff healthy? Are they testing regularly? Should we bring our loved ones home? These are all legitimate, rational concerns. So I mentioned earlier that I was my mom's care partner. And when she lived in assisted living and then ultimately in a skilled nursing facility. And while at that time I didn't physically live with her, I spent hours each day with her, helping with her basic needs, serving as an advocate, taking her to appointments, trying to ensure that she was receiving quality care, and most importantly, companionship. When your loved one lives in a facility, you're their lifeline. And COVID-19 has pretty much cut off that lifeline. And while the facility staff are doing all that they can to provide quality care, there's nothing that can replace the loving connections and hugs from family and friends. So of course, our loved ones who live in facilities may feel as if they're being abandoned. And we, their care partners, feel as if we are abandoning them. We can't help but feeling guilty. Their daily activities have been greatly curtailed. Their interaction with others is limited to the facility staff, who, by the way, really do have to be commended. Their jobs are really, really tough these days. So your fears, your frustrations, and even your guilt are valid emotions, and many of us are feeling these days, including me. So my mom passed away 6 years ago at age 94, but her twin sister just celebrated her 100th birthday, 2 weeks before the country shut down. My aunt is almost completely deaf and has dementia. She lives in a skilled nursing facility. And before all of this, I visited her regularly. We had a really close relationship. But now, because she's unable to hear, I can't even call her on the phone. Computers are confusing. She doesn't fully understand why her family can't visit her. At the beginning of the shelter in place, all we could do was stand outside her window with big signs that said, "We love you, we miss you, we can't wait until we can come in and visit you." All we could do was blow kisses, and it was really heartbreaking. But I had to focus on the joy that my aunt got out of our little window visits, seeing the delight on her face, and knowing that she felt loved and knowing that those emotions would linger. That was the best we could do. Or at least that's what I thought. Because several weeks ago, The activity director at my aunt's facility asked if we wanted to try Skype, Zoom, or FaceTime with her. And at first we declined because of the hearing impairment. But then I remembered that she wears this headset that amplifies sounds. And so I asked the activity director if he could plug her headset into an iPad so she'd be able to hear us if we did a Zoom call, and it worked. So now we have standing Zoom meetings with her every Tuesday and Friday. There have been times when we have about 10 family members on the call, and I wondered if that would be confusing for my aunt, and it kind of is, but she's so happy to see us. She always exclaims, "My whole family is here." And then it's pretty much immediately followed by, "Why doesn't anybody come to see me anymore?" Remember, she has dementia. So we need to tell her again and again that it's the virus's fault, and we will be there in person just as soon as we can. So the key to being a successful advocate for your loved one in a facility is to be sure that the staff knows who you are, the squeaky wheel phenomenon. And you need to know who they are and how to contact them. You may find that your best advocates at the facility are the social worker or the activities director, because they really are focused, on the social emotional well-being of your loved one. Facilities should be sending you regular updates through email, and if there's an urgent matter, very definitely a phone call or a text. Be sure they have accurate contact information for you and two other responsible parties, just in case. If you're not satisfied with the facility's communication, contact your local ombudsman office. This is a group of people, it's an organization, they serve as advocates for elders in long-term care. And there is a link to that information on the resource page. I have a link to both the Alameda County and Contra Costa Ombudsman's office. I could never say that. Ask the facility how they're keeping everybody healthy. Are they following all the county and CDC guidelines for infection control? And there are links to all of this information, again, on your resource page. So the social and emotional health of your loved one is just as important as their physical safety. So what's the facility doing to maintain social connections now that the communal activities and visitations are restricted? Communicate with your loved one through phone calls, Skype, Zoom, FaceTime. Ask for help from facility staff. They too want your loved one to stay connected and healthy. And if it works for that facility that your loved one is in, you can also try the window visits. In the event that a resident needs to be hospitalized, what's the facility's policy for a safe return? Do they have designated isolation areas for those who need to quarantine after a hospitalization or for those who've tested positive? CDC, Centers for Medicare Services, have really specific guidelines regarding this. And again, information on your resource page. Ask the facility what plans they have in place for a safe reopening. Although I worry that I'm just too optimistic here. Caregiving is hard, but we always have to remember that no one is perfect and we are doing the best that we can. And this is really new territory for all of us. So some of you with loved ones in facilities may have asked yourselves the question, should I bring my loved one home? I know as soon as all this COVID stuff started, that was kind of my family's knee-jerk reaction was, let's get her out of there. But we realized that we really needed to make this decision really carefully with our heads rather than with our hearts. I'm going to give you some guidelines, but this decision is highly personal and it's very unique to your situation. First of all, just a caveat, if your loved one has tested positive for COVID, bringing them home creates a multitude of risks for you, your family, and your loved one. They will have to be isolated in your home, and providing the type of medical care that they need will be complicated and most likely compromised. This is something that you really need to discuss with your loved one's physician. But let's look at bringing a loved one home who does not have COVID-19. It's still really complicated. We first have to consider the level of care that's needed. Do they need help with bathing, toileting, getting in and out of bed, dining? Are there medical needs such as colostomy care, insulin injections, breathing devices, a complicated medication schedule? Do they need any other type of therapy, daily exercise? And we can't forget their social and emotional needs. So are you and your family able to provide that kind of care? Are you physically able as a caregiver to transfer from bed to bathing, to toileting, to all of those types of things that you need to do? Will you need to make accessibility adjustments to your home? How involved will that be? How much will it cost? And can it be done in a short period of time? Are there others who live in the home? And do they work outside of the home? You have to be really concerned about what they're going to be bringing back. Are there school children or teenagers? How will this affect them? Remember, you need to ensure that your home is safe and that contact with others is minimal. So while limiting the number of people who have contact with the individual is important, it's also important to assess the number of people needed to provide adequate care. Are you able to hire home care and/or home health care? And then, of course, we always have to consider finances. While placement in a facility is very expensive, your loved one does get 24/7 care and room and board. Will your loved one lose any public assistance benefits like Medi-Cal or VA if they are no longer in a facility? And applying for resources takes a lot of time, sometimes months. This is something that we really had to consider with my aunt because she, at this point, is a Medi-Cal patient. Will your loved one lose their place in the facility? So let's say you bring them home and you discover that it's not working out for whatever reason, and you want them to return to the facility. Even though they may have been a resident for many years, as soon as they leave, the room is up for grabs, and there are often waiting lists. The facility needs to make money and they can't really hold the room. So is your loved one on Medi-Cal? Medi-Cal beds and facilities can be really, really hard to find. And then, of course, there's transfer trauma. Think about how hard it is for us to move into a new residence. Your loved one most likely thinks of the facility as their home. They have their routines. They're pretty well known by the staff. Even though moving in with someone they know may sound appealing, there will be an adjustment. And if your loved one has dementia, change is even more debilitating for them. You may be thinking, and rightly so, that should your loved one take a turn for the worse, you don't want them to die alone. And that's what we hear about in hospitals and nursing homes. So just a couple of things to consider. Compassionate care guidelines are now in place, and they're regulated by state and federal agencies. They do permit loved ones to visit in a facility or a hospital if death is imminent. So if your loved one is on hospice, they can also have hospice care in the facility, and loved ones can be with them when they're close to death. And usually within limits, you can't bring in the whole family. It's usually one visitor at a time. Hospice or palliative care may be considered if it appears that your loved one is in rapidly declining health and/or death is expected soon. You may want to bring your loved one home, assuming they've tested negative for COVID, for the period of time prior to their passing. You can bring hospice in to provide medical care and support for the patient and the family. And with hospice, you'll receive the medical equipment such as hospital beds, oxygen, anything that's necessary to keep your loved one comfortable. It's a lot to think about, which is why we need to prioritize self-care. Research tells us that providing care for an elderly or a chronically ill loved one is one of life's most stressful situations. I know this from both personal and professional experience. So let's add a global health pandemic, a struggling economy, and social unrest to that already complex situation. That can trigger unrelenting anxiety in even the most emotionally stable of us. I want you to view self-care then as a gift that you're giving not only to yourself, but to your loved one. If something happens to you, what's going to happen to them? Remember that self-care isn't just about eating well, getting enough sleep, exercising, and going to the doctor. Equally important are your social, emotional, and spiritual health. All aspects of our health must be in balance. So what do we do? I think a good first step is to acknowledge what is outside of our control: the virus, the economy, the behavior of others, even though it can be so annoying, and maybe not even your own situation is within your control. Try to let those go. It's easier said than done, I know. But we can control our attitude and our behaviors, how we view our situation, and how we respond to the crisis. Sometimes I find myself not even wanting to make plans for the future. However, research tells us actually that thinking about and even preparing for the future gives us a sense of optimism and hope. It's okay to think about and even plan for vacations, weddings, other happy events. Of course, always keeping in mind that we have to be creative and flexible. One of the best gifts that you can give yourself and your loved ones is to make known your end-of-life wishes. Now more than ever is the time to be sure that you have this conversation and that you have the legal documents in place. You need to have a serious conversation about what life-sustaining measures are desired. You will want to discuss if your loved one would prefer only comfort care at this time, palliative care, hospice care, if it appears that they'll not survive. Comfort care does just that. It ensures that the patient is comfortable at the end without any aggressive medical treatment. And you can find really comprehensive information about having advanced health directives in place on the Hope Hospice blog. I wrote one on April 28th about this. We've also at Hope done a couple of webinars on advanced directives. I believe it's called 5 Wishes, and that's also on our website. Remember FOGO, fear of going out. You need to plan for how you're going to stay safe if you do go out. Just because we can start doing a few of the things we did before doesn't mean that it's safe. And it doesn't mean that you'll feel comfortable. Most likely your loved one is part of that vulnerable population. Maybe you are too. You may consider opening up your protective bubble to include some trusted family and friends. Outside visits with masks tend to be relatively low risk, but always remember, returning to normal is a process, not an event, which is one of the reasons that we have surges in so many places. And the process is going to be even slower for vulnerable populations. Remember that not only are you responsible for the safety of your loved one, but as your loved one's lifeline, you must also take your own health into consideration. This means a really careful evaluation of risks in interacting with others. Do you have a backup caregiver designated? Someone who can take over at a moment's notice, like for when you get sick? It's important to prepare for the time that you may need to rely on others to care for your loved one. I strongly recommend that you prepare an emergency folder. You may keep the information current on your computer or on your smartphone, but it is recommended that you have information in a physical notebook or folder that's easily accessible to your backup care partners and emergency personnel should they need it. Also, discuss these emergency arrangements with your support team, your family, or close friends, and ensure that they know where all the important information is located. Your emergency notebook is going to contain some sensitive information, so make sure that you only share it with trusted individuals. So I have a handout that's going to be posted on our website that shows what items should be included in your notebook. And so your folder should include personal info about the care recipient, medications lists, medical providers, emergency contacts, their daily routine. It should also show your backup caregiver where to find all of the legal and financial documents. Those specific items don't need to necessarily be in the folder, but the backup caregiver needs to know where you have those located, just in case you're out of commission for an extended period of time. So again, this particular document that's on the screen now is going to be, that'll be on the page that you can upload on our website. So let's continue with things we can control. Stress. Do you view stress as a threat or a challenge? Professional athletes and performers have learned to use the stress response to improve their performance. Can we do the same? Can we turn this crisis into an opportunity to grow as human beings and increase our ability to bounce back from tough situations? So stress has always stressed me out. Sounds a little bit cliche. I stress about having too much stress. I'm always thinking it's going to give me a heart attack because of that pounding, tight sensation in my chest. And then a few years ago, I happened upon this TED Talk, and it kind of changed the way I view stress. The title of it is kind of weird: How to Make Stress Your Friend. So this became my favorite TED Talk, and I'd like to share it with you right now. And if you've attended my classes before, you've seen it. But if you're like me, I really need the reminders.
I have a confession to make. But first, I want you to make a little confession to me. In the past year, I want you to just raise your hand if you've experienced relatively little stress. Anyone? Mm-hmm. How about a moderate amount of stress? Who's experienced a lot of stress? Yeah, me too. But that is not my confession. My confession is this: I am a health psychologist, and my mission is to help people be happier and healthier. But I fear that something I've been teaching for the last 10 years is doing more harm than good, and it has to do with stress. For years, I've been telling people stress makes you sick. It increases the risk of everything from the common cold to cardiovascular disease. Basically, I've turned stress into the enemy. But I've changed my mind about stress. And today, I want to change yours. Let me start with the study that made me rethink my whole approach to stress. This study tracked 30,000 adults in the United States for 8 years. And they started by asking people, how much stress have you experienced in the last year? They also asked, do you believe that stress is harmful for your health? And then they used public death records to find out who died. Okay. Some bad news first. People who experienced a lot of stress in the previous year had a 43% increased risk of dying. But that was only true for the people who also believed that stress is harmful for your health. People who experienced a lot of stress but did not view stress as harmful were no more likely to die. In fact, they had the lowest risk of dying of anyone in the study, including people who had relatively little stress. Now, the researchers estimated that over the 8 years they were tracking deaths, 182,000 Americans died prematurely, not from stress, but from the belief that stress is bad for you. That is over 20,000 deaths a year. Now, if that estimate is correct, that would make believing stress is bad for you the 15th largest cause of death in the United States last year, killing more people than skin cancer, HIV, AIDS, and homicide. You can see why this study freaked me out. Here I've been spending so much energy telling people stress is bad for your health. So this study got me wondering, can changing how you think about stress make you healthier? And here the science says yes. When you change your mind about stress, you can change your body's response to stress. Now, to explain how this works, I want you all to pretend that you are participants in a study designed to stress you out. It's called the social stress test. You come into the laboratory and you're told you have to give a 5-minute impromptu speech on your personal weaknesses to a panel of expert evaluators sitting right in front of you. And to make sure you feel the pressure, there are bright lights and a camera in your face, kind of like this. And the evaluators have been trained to give you discouraging nonverbal feedback, like this. Now that you're sufficiently demoralized, time for part 2, a math test. And unbeknownst to you, the experimenter has been trained to harass you during it. Now, we're going to all do this together. It's going to be fun. For me. Okay. I want you all to count backwards from 996 in increments of 7. You're going to do this out loud as fast as you can, starting with 996. Go. Go faster. Faster, please. You're going too slow. Stop, 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 stop. That guy made a mistake. We're going to have to start all over again. You're not very good at this, are you? Okay, so you get the idea. Now, if you were actually in this study, you'd probably be a little stressed out. Your heart might be pounding, you might be breathing faster, maybe breaking out into a sweat. And normally we interpret these physical changes as anxiety or signs that we aren't coping very well with the pressure. But what if you viewed them instead as signs that your body was energized, was preparing you to meet this challenge? Now, that is exactly what participants were told in a study conducted at Harvard University. Before they went through the social stress test, they were taught to rethink their stress response as helpful. That pounding heart is preparing you for action. If you're breathing faster, it's no problem. It's getting more oxygen to your brain. And participants who learned to view the stress response as helpful for their performance, well, they were less stressed out, less anxious, more confident. But the most fascinating finding to me was how their physical stress response changed. Now, in a typical stress response, your heart rate goes up and your blood vessels constrict like this. And this is one of the reasons that chronic stress is sometimes associated with cardiovascular disease. It's not really healthy to be in this state all the time. But in the study, when participants viewed their stress response as helpful, their blood vessels stayed relaxed like this. Their heart was still pounding, but this is a much healthier cardiovascular profile. It actually looks a lot like what happens in moments of joy and courage. Over a lifetime of stressful experiences, this one biological change could be the difference between a stress-induced heart attack at age 50 and living well into your 90s. And this is really what the new science of stress reveals, that how you think about stress matters. So my goal as a health psychologist has changed. I no longer want to get rid of your stress. I want to make you better at stress. And we just did a little intervention. If you raised your hand and said you'd had a lot of stress in the last year, we could have saved your life. Because hopefully the next time your heart is pounding from stress, you're going to remember this talk, and you're going to think to yourself, this is my body helping me rise to this challenge. And when you view stress in that way, your body believes you, and your stress response becomes healthier. Now, I said I have over a decade of demonizing stress to redeem myself from. So we are going to do one more intervention. I want to tell you about one of the most underappreciated aspects of the stress response. And the idea is this: stress makes you social. To understand this side of stress, we need to talk about a hormone, oxytocin. And I know oxytocin has already gotten as much hype as a hormone can get. It even has its own cute nickname, the cuddle hormone, because it's released when you hug someone. But this is a very small part of what oxytocin is involved in. Oxytocin is a neurohormone. It fine-tunes your brain's social instincts. It primes you to do things that strengthen close relationships. Oxytocin makes you crave physical contact with your friends and family. It enhances your empathy. It even makes you more willing to help and support the people you care about. Some people have even suggested we should snort oxytocin to become more compassionate and caring. But here's what most people don't understand about oxytocin. It's a stress hormone. Your pituitary gland pumps this stuff out as part of the stress response. It's as much a part of your stress response as the adrenaline that makes your heart pound. And when oxytocin is released in the stress response, it is motivating you to seek support. Your biological stress response is nudging you to tell someone how you feel instead of bottling it up. Your stress response wants to make sure you notice when someone else in your life is struggling so that you can support each other. When life is difficult, your stress response wants you to be surrounded by people who care about you. Okay, so how is knowing this side of stress going to make you healthier? Well, oxytocin doesn't only act on your brain, it also acts on your body. And one of its main roles in your body is to protect your cardiovascular system from the effects of stress. It's a natural anti-inflammatory. It also helps your blood vessels stay relaxed during stress. But my favorite effect on the body is actually on the heart. Your heart has receptors for this hormone. And oxytocin helps heart cells regenerate and heal from any stress-induced damage. This stress hormone strengthens your heart. And the cool thing is that all of these physical benefits of oxytocin are enhanced by social contact and social support. So when you reach out to others under stress, either to seek support or to help someone else, you release more of this hormone, your stress response becomes healthier, and you actually recover faster from stress. I find this amazing that your stress response has a built-in mechanism for stress resilience. And that mechanism is human connection. I want to finish by telling you about one more study. And listen up, because this study could also save a life. This study tracked about 1,000 adults in the United States, and they ranged in age from 34 to 93. And they started the study by asking, how much stress have you experienced in the last year? They also asked, how much time have you spent helping out friends, neighbors, people in your community? And then they used public records for the next 5 years to find out who died. Okay, so the bad news first. For every major stressful life experience, like financial difficulties or family crisis, that increased the risk of dying by 30%. But, and I hope you are expecting a but by now, but that wasn't true for everyone. People who spent time caring for others showed absolutely no stress-related increase in dying, 0. Caring created resilience. And so we see once again that the harmful effects of stress on your health are not inevitable. How you think and how you act can transform your experience of stress. When you choose to view your stress response as helpful, you create the biology of courage. And when you choose to connect with others under stress, you can create resilience. Now, I wouldn't necessarily ask for more stressful experiences in my life, but this science has given me a whole new appreciation for stress. Stress gives us access to our hearts. The compassionate heart that finds joy and meaning in connecting with others. And yes, your pounding physical heart working so hard to give you strength and energy. And when you choose to view stress in this way, you're not just getting better at stress, you're actually making a pretty profound statement. You're saying that you can trust yourself to handle life's challenges. And you're remembering that you don't have to face them alone. Thank you.
Thank you. I hope you enjoyed that video and listening to Dr. McGonigal. As I said earlier, I've listened to it so many times, and it gives me some optimism, in particular now with all of the stressful things that are going on right now. Optimism that I can make stress work for me, and I hope that's the case for you too. So let's get back to things that we can control. So the words that we choose to describe situations, ourselves, others, the labels that we use have a huge impact on our perception and our interpretation. Language determines the way that we think. It can influence whether we view something positively or negatively. Let me give you some examples. The term social distancing. Kind of hate that term, because I don't want to socially distance from other people. It makes me think of isolation, and I don't like that. But what if we were to replace it with physical distancing? We are physically distancing, but at the same time, we can be still socially connecting with others. So besides FOGO, I learned some other new terms when I was doing research for this presentation: doom scrolling and doom watching. So I find myself addicted to reading the news feed on my phone and watching cable news, and I do it way more than is healthy. My excuse is that I keep hoping to hear some good news, but I really don't even believe that myself. But I've discovered over the last couple months that if I label my behavior doom scrolling or doom watching, I actually find that I'm doing it less. I also find, since I've taught my husband those terms, that he goes, "Are you doom watching again?" And then it's like, "Oh yeah, we need to change this behavior." Now, it's really important to stay informed, but we have to find that healthy balance between being informed and being overloaded, especially with all the negative stuff that's out there. We just learned how to make stress our friend. And while we may not have control over our stressors, we do have control over how we react to them. So choose your battles, know your triggers, let go of the minor stuff, and direct your energies towards what's really important. And right now, that's the health and safety of yourself and your loved ones. So remember, if you succumb to fear and anxiety and worry, stress will not be your friend. But if, as we learned from Dr. McGonigal, if you view stressful situations as a challenge from which you can learn and grow and bounce back, as a way to make you more productive and more compassionate, then the stress response can actually be helpful to your overall well-being. And speaking of well-being, we do have complete control over how we care for ourselves. But who has time? I know if you're like me, I tend to put self-care at the bottom of my priority list. We have to change that. So we all have time for self-care because there's a lot of things we can do in just a few minutes. So Jane Travis is a British therapist who writes a blog that I recently discovered. And this particular article was written pre-COVID. So a couple of her examples may not apply, but they're pretty easy to adapt. What I like about her is that I think she's really funny. She has a really quirky British sense of humor. And right now, laughing is so good. Also, she does something that I love and that I try to do as well. And she provides links that support and supplement all of her tips. So I'm hoping that you can find 5 minutes to read about some self-care strategies that take 5 minutes or less. Also on our website, I've posted an excellent document, Self-Help for Sheltering in Place. This was developed by Kathleen Brand, and Kathleen is Hope's Director of Bereavement Services, and it's about 6 pages long, and it contains dozens of links to other great resources that I think you'll find really helpful. I think the key to surviving this is through education. And I don't know, maybe it's because I'm a teacher or such a believer in lifelong learning. But right now we need to educate ourselves not only to help us better understand the pandemic and learn to protect ourselves, but we also need to learn new things to keep our minds and our bodies active. It does wonders for our self-worth and our well-being. So there's so many online courses, webinars, podcasts, TED Talks, even some of those silly YouTube videos. Find something that interests you, that challenges you, that makes you happy, that makes you laugh, maybe makes you able to escape for just a little bit. You can join an online support group or even get individual therapy online these days. Take a cooking class or an art class, a craft class. Check out an exercise program, Tai Chi, yoga, try meditation. It's easy to feel like a victim these days, to feel as if everything is spiraling out of control. And by the way, you're not alone in those feelings. As I said earlier, those feelings and fears are one of the few normal things in these abnormal times. So we need to be kind to ourselves and try to keep reminding ourselves that everyone is struggling now. We're doing the best we can. And always remember how you handle this crisis is within your control. So I would like to leave you with one of my favorite quotes. Everything will be okay in the end. If it's not okay, it's not the end. Let's take a look at the Q&A.
Yeah, there's one question in the Q&A. Debbie, I can read it to you.
Okay, and I'm looking at it right now.
Okay. How can a person with progressive dementia be cared at home? Pros and cons, home versus senior facility.
Okay, so actually, if Gia is still with us.
So yeah, thanks for reading the question, Phil. And this is a question that Debbie addressed a little bit in her presentation when she was talking about, oh gosh, what was the slide? Should I bring my loved one home was the slide. And everything that Debbie said, I echo. And unfortunately, this is a really personal decision and a very individual decision because a lot of factors influence what goes into making this decision. For example, considering the safety of the person, their safety at home versus their safety in a facility. How safe can you keep them at home? Their level of care, as Debbie mentioned earlier, how much care are you actually able to provide yourself? Do you need to bring in caregivers to help you out? And financial decisions, are you able to afford to bring caregivers in to help you out? All of those things that Debbie talked about earlier are really big factors. This is a really good conversation to have with your family together so that you can make a decision that everybody is on board with. And maybe everybody has some ideas about how they can assist, whether it's financially or whether it's physically with time. So I don't know if that answers the question at all. I think it was Manisha who answered or who asked the question, but I'm also happy to spend some time later individually with you, sort of talking through your particular circumstance and seeing if we can't come up with some strategies for helping you find answers to those questions. So if you would like to reach out, please feel free to do so. You can just call Hope Hospice's main line and ask for me, Gia Barcel. Okay?
Yeah, and as I mentioned at the beginning, Gia is available for individual consultations, family consultations. So yeah, I'm thinking that the person who asked this question, might be really well served, if she were to have a, private conversation with you, and then she could, really tell you what her specific concerns are.
Definitely.
Okay.